Hello, well, welcome back to day 3, and this will be about improving health outcomes. Now, the main thrust about this is that it starts with talking about discarding the culture of targets, and there's going to be much more emphasis on outcomes, and this comes back to improving the outcomes, which, although we've had targets, we've actually not had outcomes to deliver. So it's about improving mortality rates and general patient experience. And as they say, as targets could crowd out the bigger objectives of reducing mortality and morbidity. Performance will be driven by patient choice and commissioning. Patient safety will be put at the heart of the NHS. And information will help to boost the transparency where staff and patients are empowered to ask. If it says it will replace the relationship between politicians and professionals to a relationship with the professional and patient using credible evidence measures to make decisions. Separate outcome frameworks for public health and social care and a new outcomes framework will provide new direction for the NHS. The NHS Outcomes Framework will be translated into the commissioning outcome framework. So that's what they buy will be driven by this outcomes framework. The new outcomes framework will span 3 domains. The effectiveness of treatment and care provided to patients measured by both the clinical outcomes and patient-reported outcomes. 2, the safety of the treatment and the care provided to the patient. And 3, the broader experience patients have of the treatment or care they receive. A focus on patient outcomes that's health and social care services are better integrated at all levels of the system. So it's going to mean much better cooperation between NHS trusts and local authority provision. There will be progress on outcomes will be developed for the NHS Commissioning Board by Nhs, who will develop authoritative standards setting each part of the patient pathway indicators for each step. So each part of the patient pathway will have an indicator. Nhs will advise the National Institute for Health Research on what sort of thing will need to be commissioned. Health commissioners will draw on Nhs and the Library of Standards as they commission care for the NHS consortium, and providers will agree local priorities for the implementation each year. Taking into account the NHS Outcomes Frameworks, the Nhs quality standards will be reflected in the commissioning contracts and the financial incentives. Now, there's going to be a big emphasis on research. They see this as, the government see this as a core element, and the NHS role is essential in improving health outcomes and reducing inequalities. And by making more of the research element, they hope to increase quality and productivity in the NHS. So seeing what actually works is going to be very important. And there's also going to be incentives for quality improvement. So if you've got research to back that up, obviously there's going to be incentives there to do it. And I think there's been some criticism of there being an absence of effective payment system and a reward for results. So it's going to be a comprehensible and transparent, sustainable structure for payments and performance so that the money follows the patients and reflects quality. Payments and the currencies, and that's a term that they use, currencies, are based on and will be structured on the way the most relevant to the service being provided. So it won't be standard that if your services goes one way, the currencies and the payments will go in the way that the service dictates. There will be best practice, of best practice tariffs. There will be best practice tariffs, so providers are paid for best practice. If a provider delivers excellent care in line with commissioning priorities, the commissioner will be able to pay a quality increment. The scope for commissioning for quality and innovation payment framework to support local quality and improvement goals, and these will be important in supporting the implementation of nice quality standards and improving the patient's experience and reported outcome. If a provider delivers poor quality care, the Commissioner will also be able to impose a contractual penalty, particularly the occurrence of never events such as wrong site surgery. Rewarding quality will also extend to primary care with an adoption of a single contractual funding model. The principle is that funding should follow the patient on a weighted capitation model adjusted for quality, incentivising ways of improving access to primary care in disadvantaged areas. A new dentistry and pharmacy contract will be developed so that there will be an increase in quality in these areas. There will be an emphasis on children's oral health, and there will also be reform in the way that drug companies are paid for NHS medicines, and in the interim there will be a cancer drug fund set up. Now the questions for today are: do you agree with the way that the government wants to change the health service? And what does that mean for you? Do you agree with the principle that quality should be rewarded? And how does that change your job as a result? So, and if you've got any other comments on the chapter, please put them down. But answer any aspect of the questions that you think you can contribute to. Thank you.